Okay, welcome to the roundtable discussion. We have an incredible panel today, and I thought Candace would have the pleasure of moderating this, but nope, it's me.
I don't know if she can handle us.
I don't know if I can handle you, but I am certainly going to try. So with us today is Dr. Orbach from the Weiner Wellness Center. He is a doctor of chiropractic medicine. He's also an incredible person, a very well-rounded functional medicine approach to your body, mind, body, and soul. I loved his lecture yesterday. And then, of course, Jamie Dorley, CEO of Nutritional Frontiers, and Joe Messino, one of our lead educators at Nutritional Frontiers, and for the Weiner Wellness Center. Joe, you do a lot with both companies. So I'm going to let you guys just have a little discussion about health. We have some participants in the box. I'm going to put the chat box up. I'm also going to go share this link to our Facebook page. So why don't you start out with a little discussion on the week and some challenging health questions that you had.
Well, yeah, thanks to everybody at the Weiner Wellness Center. Thanks to Dr. Orbach. Thanks, Tracy, Joe. I love how the team really came together this week, and today is a special day. Today is Cinco de Ocho, which is May 8th, otherwise known as our 12th birthday today, Joe.
Yeah, baby.
12 years. Happy birthday and congratulations.
Thank you. And Dr. Orbach, I think you've been there since the beginning at the old pain release clinic.
I remember in the Southside office when the HA Plus came out, and I think it was in a gold labeled bottle.
Yes.
And it stood out because it was the only gold labeled bottle. And we were directing people it was like we had ballroom dancing steps on the floor, directing people where to go and when, and it just ended at the HA Plus. And that product, it might have been because it was the first product and there was all the buzz around it. It might have been because I had recently joined the team and I have such a musculoskeletal ache and pain approach. It might have been because Dr. Weiner was over the moon about starting the company. It might have been all of the above. But that product, it literally sprouted wings and flew off the shelves. And you know what? 12 years later, doing the same thing, except it's no longer in a gold label.
Yeah, it's a great memory.
Yeah.
That was
Yeah.
the original formula that was
Right.
actually grandfathered in. Dr. Weiner was so generous, as he reminded us, that he grandfathered that product in. And originally came in a 60 count bottle. That was it, right? The black
Right.
and gold label. And it wasn't even the Steelers gold. It was like real gold, right?
Yeah, yeah.
Gold color.
Yeah.
Just like the gold room.
Right.
And here we are now, 12 years later. We have it in a 120 size, a 240 size. We have it in a vegetarian powder. And
Flying off the shelves. People love it.
Yeah, I think it's done so well because, again, you guys were the pain release clinic and now the Weiner Wellness Center, doctors of chiropractic. And, you know, I always say that a lot of women are very open to functional medicine, but men seem to be a lot more stubborn. Don't you agree, Tracy? Yes. So I think, you know, there's been two spikes in the industry, of course, you know, with people with erectile dysfunction and then with any type of pain. When a man can't walk, can't work in the yard, they're willing to try anything, right, Joe? And
can't work, can't walk, can't, play in the bedroom. They'll try anything.
Yeah, so the HA Plus has continued to have wings on it because it does improve people's function. It helps them work better, helps them prevent surgeries. It helps them take apart a Dr. Orbach home with them after you're doing the adjustment and the muscle therapy. And, you know, your body continues to rebuild that tissue, and that's why it's done so well. So I love reminiscing. Today was so fun talking about all those times going from that pain release clinic to the Weiner Wellness Center. And
I think it's also important to note that the HA Plus is multimodal. I mean, we've seen that product for sale in beauty clinics, places where the focus is more on aesthetics than aches and pains because of the ramifications that the HA Plus, the hyaluronic acid, the HA Plus has on skin, creating more moisture, better lubricated skin. It's just, I mean, it speaks pretty well for the whole Nutritional Frontiers line in the sense that so many of your products have what's your term, Joe? Unintended positive side consequences.
PSEs, doc. PSEs.
Positive side effects. And also to your point, a moment ago, Jamie, you're right. I mean, we have so many more female patients than male patients, but I think there's a shift. I think the guys are starting to catch up a little bit, and more we're seeing male patients, guys coming in talking about what can I do for my thyroid, what can I do for my digestion, and I think I don't know if we got there yet, but I think we're certainly headed towards a tipping point where people are sick and tired of the the side effects that go with medication. I mean, we can't deny the effectiveness of medicine, but we can't deny so many of the side effects either. And people are more and more eager to start doing something naturally first, regardless of their gender. And we're just starting to see that more and more. It's kind of a welcome thing.
Yeah, that's a great point, Joe, that he makes. Because remember Doc saying is you can always do the medicine and surgery later.
Hmm.
But if you start there
Right.
and then they come to see you, Dr. Orbach, and they already had complications of a knee replacement,
Right.
now you're going uphill.
Right.
It becomes so much harder for you to get the results that you're looking for. So, yeah, I mean, HA Plus is where it all started, Joe.
Yeah, HA Plus was great. I mean, and then of course, right after that, the next big product, Probezyme. That was the next one that was specifically on the NF label. I know HA
Right.
Plus came over,
Yeah.
but then Probezyme came in and just blew everybody away.
Well, I think even today, 12 years later, it's a pretty unique concept to combine a digestive enzyme along with probiotics. I mean, I don't know if anybody else has that on the market. So you're right. It blew people away then. It's blowing people away now.
Yeah, it's been one of the topics. I've learned so much this week, so I just want to thank all the incredible. I mean, what a
Yeah, it
lineup
was
we've
great.
had, right?
Yeah.
Makes
Right.
me so proud. And Orbach talking about mind, body, spirit. Dr. Hahnemann breaking down immune. You had Mikey and Dr. Hahnemann together on the opening morning. That was very entertaining, right? You
Yeah.
had some unique personalities and teams, and the incredible knowledge from you guys to Dr. Epitropoulos. Of course, Sherry Tenpenny, Dr. Tracy, Candace, and just seeing the growth of everybody in the team. So this has been an exciting week. You mentioned, the Probezyme. Now that we have had in 3 flavors, we have sample bottles, large bottles, and still so many people are suffering with digestion problems, Joe.
Yeah, they still are, but we're getting the word out. And this week makes the difference because, I mean, I was just thinking about this morning, and that was that look at the scope of people that we've touched this week. Sherry had 6,000 views. We've got hundreds and thousands of views on all the other workshops. We would never have been able to bring that amount of information to that many people in a regular wellness week. This opens up a whole new world.
It really does. But I have to come back to how well we were able to work together as a team here at the Wellness Center, and everybody has their job and they know what they're doing when they come to work in the morning. But this week, everybody had new side work, new jobs, new responsibilities, and I think we were all able to pull it off without anything really, no real hitch in the way. I mean, everybody came through and did what was expected of them and then some. And I also have to give a lot of credit to our customers and our patrons who just there was nobody banging on the door making a scene about I came to come in and pick, why can't I get into the building to do this? And I always knew we had none of that. Everybody understood exactly where we were, and we're trying to these are uncharted territories. We're doing our best to accommodate you. Please help out and accommodate us. And it went so smoothly. It's just A+ for everybody involved. And
it was nice to see when I was down there, you guys, or Dr. Orbach picking products, and, Monica shipping them, and, you had Adam, of course, always kicking in like he does. And
yeah,
like you said, people are very, very understanding, respectful, and supportive, right? Because
Right.
they're still supporting the business and the community, which was so nice to see.
yeah,
I know the one part we do miss is seeing everybody.
Right.
But I think it's a great feedback on Saturday when I was in the back parking lot. A woman was getting her package, and she said, I just want to thank you guys for doing these online.
Yeah.
She
Yeah.
says, because last time I wasn't feeling great, I didn't make it down here and I missed everyone. She says, especially that beautiful guy, Joe Messino.
I have a few fans out there. I have a few. But I'll tell you what, I'm loving this summit because, you know, I never get to listen to all of the workshops either, right? But now the ones I can see firsthand, and then some I can go back and watch the replays. This is just, I think we got a whole new thing going on here. Next one in July is going to be a combination, I hope,
Oh, yeah.
of the two. Yeah.
Yeah. I mean, how many times have you guys watched Dr. Sherry Tenpenny already? I'm up to 4 myself.
Yeah, like
I
every
mean,
time
just-
you learn something new.
Right. Like a good book, it just keeps getting better every time there's just one layer after another. And how did I miss that the last time I watched it?
Are
Hey, you know,
guys,
the other thing,
okay,
I
I
was
gotta
thinking-
stop you guys because
Okay,
this is
we got
supposed to be a
questions.
Q&A, and
Okay.
I have all these questions coming in.
Okay.
Oh, we got Q&A coming? Okay,
Yeah,
well,
so the
we'll-
first one, and here you go, guys. We're going to start off with a great question. Suggestion for erectile dysfunction for a 61-year-old male. High blood pressure meds. Water's okay. Diet's okay, but not great. Exercise is non-existent. He is reluctant to take supplements, but he would love a magic pill. Who wants this
Friend of
one?
yours?
No, but I,
How about if we start with some arginine? That gotta start with a little bit of exercise, and maybe look at his diet and see what he might be eating that might be inhibiting circulation. And
The first thing I'm hearing is blood pressure meds.
yes,
right?
that's because that's
You
the
know,
cause.
Yeah, the Viagra, when it first came to the market, was originally a blood pressure medication. And one of the positive side effects of the medication was that it improved circulation to all parts of the body, including the penis. So, you know, when you look at that medication, that's how it was now sold off brand, and eventually the studies came out. So what I'm hearing, I remember Doc saying this quite a bit, was that, you know, if you're depleting blood pressure, you're depleting circulation everywhere.
Mhm.
So that's a concern, and I'd like to see what can we do to help him with his medical doctor, so maybe he wouldn't need a blood pressure med, right?
Mhm.
The Magnesium Complete by Nutritional Frontiers, working with his medical doctor in conjunction with the team at the Wine and Wellness Center to see what can he do about it. Of course, diet, exercise,
Circucore,
yeah,
right off
and
the
that has
bat.
the arginine.
Has
citrulline.
arginine, citrulline, right?
Yeah, Circucore by Nutritional Frontiers would be a great start, and then Power Fuel, right?
Oh yeah, powerful, definitely. Mitochondrial repair, blood flow, everything.
And the Circucore would be safe across the board.
Across the
Um,
board, yes,
So
even with his
why- that's one-
medication.
Yeah, so I think that's probably one of the big concerns that you'll have come up. So, okay, well, that was a great answer. All right,
Yeah,
next
so a couple
question.
things there just to review.
That's
So
true.
Power Fuel,
I put them in the
Circucore,
notes.
and Mag Complete.
Mhm.
I think using those three together in conjunction with his doctor, and then trying to get him into the wellness center so these guys can work on lifestyle with him.
Yeah, absolutely. All right, I put your answers in the chat. Excellent. Okay, someone is asking about kidney stones and how can you prevent them? They have dealt with them their whole life.
You know, this is something that I'll just jump right in on because we've had some great results. Jeff Nisnik has had some great results with a protocol of combining the kidney and bladder herbal tincture along with Super K2 Plus. And the reason that those two are combined, the tincture obviously helps with the function of the kidney, the function of the bladder. So we want those two organs to be operating at high function. But then we add in the Super K2 Plus, you know, what are these kidney stones? They're calcium deposits, and nothing can prevent that more. We don't say heal or reduce them, but we're going to prevent more from happening by keeping that calcium out of the organ and into the bones and teeth. And that's what K2 does.
You know, I always look at the diet. You know, I find people that tend to have kidney stones, a lot of teas or caffeine, very acidic type of diets, right? So it's something I've always looked at is more the lifestyle component in conjunction with the protocol you're mentioning. How about you, Doc?
Well, I would go even more simple than that. And my next question would be, do you drink water?
Yeah.
It is. Um, I mean, I know what you're talking about. I mean, I work with Jeff every day, and we've
Yep,
talked about
yep.
the protocol that he's been putting together, and it's really, I mean, it's really very good thinking on his part, and it's solid. But if somebody's drinking a liter of Coke every day and a few sips of water, you want to prevent this going forward. I mean,
Well,
let's go.
such a great point, Doc. Such a great point, because the carbonic and phosphoric acids in these colas are causing more of the problem. I mean, let's get to the cause. And like you said, you got to get the diet.
That's why I
Yeah.
said lifestyle, because, there's a reason why this is happening.
Mhm.
And I love when, defense of them, they say it's happening their whole life because their diet has been like that their whole life,
Right.
right? I
Mhm.
think when people think, oh, this has been going on a long time, only because it hasn't been fixed, right? And oh, well, my dad has it too, because you guys drink and eat the same types of foods, same types of stressors,
Yeah.
same types of toxicity.
Sure.
So yeah, I love it. Go back to the basics, folks. 90% of the causes are basic fundamental things that we maybe take for granted, but maybe people don't. Another reason why to call down there, to do telemedicine, get some good foundational concepts on what you need to do.
Yeah. Awesome. Okay, next question. This is, I think, probably for Dr. Werbach first, and then maybe you guys can follow up as well. The new mommy has a baby with severe colic,
Mhm.
and her friend is recommending that the baby get adjusted. Is that something that you would recommend? And is there any other supplements that would help?
Well, certainly, certainly, I recommend adjustments. That's my go-to. I have adjusted the youngest patient I've adjusted was 9 days old, and when you have that severe colic, we hypothesized on this particular newborn that it was a hiatal hernia, and I adjusted this 9-day-old their tiny little belly, and it took a couple of treatments, but I'm not going to say that it resolved the problem by itself, but it really helped a great deal. And the particular patient that I'm thinking of, the mother was breastfeeding, so we had the mother take a lot of probiotics, a lot more than what we would normally recommend.
Mm.
And I see those people. I haven't seen the baby, but the mother was so pleased with how things went that she's a sporadic, occasional patient now, and
Mhm.
always gives me a good update and a progress report. So that would be the place where, from a hands-on chiropractic perspective, I would want to begin.
Okay.
Certainly checking the stomach.
Well, I
Yeah.
know as a mom, I had my kids adjusted 2 hours after they were born. My chiropractor friend came to the hospital and did cranials, and and I think people, can you just give the experience maybe? Because I think people think it's like an adjustment, and it's really not, right? When
No.
you work with a baby.
It's more like a well-placed fingertip
Mm,
and an exhale. It's
okay.
really, if one of my adult patients came in and I adjusted them the way I adjust a baby, they would look at me like, if
They
I
want
were
their money back.
flexible. Yeah, not only do I want my money back, but you owe me for time and commuting over here, and you should pay for my car's gas to get here. I mean, it's really, think about, if somebody were going to put a finger on your eyeball, how much pressure would you want them to put down on your eyeball? I mean, it's like barely a touch. It's more like a very sustained touch in the right place, not really it's a no force adjustment is what it is. So no, we're not twisting little babies' necks, and we're not pulling on their ankles until their whole legs come off of their torso. Absolutely not. Uh, um, it's think precision, think light touch and precision with eyeball pressure. So that's
Great explanation. Thank
I
you.
mean,
Do
great
you?
protocol. Yeah, Doc. Probiotics, that study from Italy about 10, 12 years ago showed that the majority of the babies with colic came from a mother that either A, delivered cesarean, or 2, did not nurse, and 3, all of the above. And so the probiotic activity transfer from the mother was not there, therefore the indigestion in the baby.
Yeah, and that's why we came out with the new Woman's Complete, right? Because that way, even before the baby's born, they're getting the probiotics in. So that's a new formula available at the Weiner Wellness Center. We updated that formulation over the development because we want to make sure that all the vitamins and minerals, the proper forms and dosages, but also some key probiotics that the mom can safely get, pass on to the newborn, and then even afterwards when they're breastfeeding, passing those probiotics on. So that's why we came out with the Woman's Complete. I know I get a lot of questions from people. Oh, is chiropractic safe? Would you? I says, look, ask me this question when I take my kids there. Yes, I took my son there to Dr. Weiner's pain release clinic going back 20 years ago because his heels hurt when he was playing a baseball tournament. I've told this story 100 times. My daughters have gone to see chiropractors at the Weiner Wellness Center. Your grandkids and kids go there routinely, right? So, folks, if we do it, Tracy's done it with a newborn. Dr. Orbach has all the experience. It's very safe and effective. And I highly recommend the earlier the better to get them in the routine and the habit so that their bodies will get the full benefit starting at a young age. The longer you wait, the more catch up you got to play. You can't wait till you're 70 and get a hip replacement. Start when the mom is pregnant and then all the way through.
Even babies have spinal columns, right, Doc?
Yes,
Yeah.
they do. Yes, they
And I
do.
always say that it's like
Yeah.
coming out of the Play-Doh fun factory of life. You know, everybody should be adjusted. So, question, and the other thing that I wanted to mention on that is, you know, my children don't know any different. So when they get sick, fever, they don't feel good, they will literally say, "Mommy, can I go get my bones cracked?" That's what they say. That's how we say chiropractic in our house. And I'm like, "Yep, we'll call the doctor," and we go in. So they would love you, Dr. Orbach. What nutrition protocol would you recommend to somebody who just came off chemotherapy for cancer? That's all the info I have. No.
Yeah. Look, your immune system has just been severely attacked. So anything you can do to boost your immune system from DMG to D3, Immunomax, just as much nutrients as you can get in your body, a gray multi, good minerals, good antioxidants, the whole food, the earth diet, the of the earth diet. I mean, you just got to build back up again because you've just gone through a war. And as far as nutrients, as much D3 as you can get in, as much DMG as you can get in you, and then just take it from there, right, Jane?
Yeah, I actually get quite a few people that call me, either friends or family, whatever it may be, that at least the docs are recommending they get some kind of protein. Because anytime someone's on a medical protocol, that's fine. I just want to see how can I meet where they are and give them exactly what they need, not so much for the cancer, but to get their body recovered.
Right.
And the biggest thing that you'll see with people on chemotherapy, radiation, some really aggressive treatments is they'll lose a lot of muscle. And I remember my mom, I knew she was in trouble when she was a solid woman. I gave her a hug one time and I was like, oh my God, because her arms, there was no more muscle. And shortly after that, she wound up passing. So the first thing we're going to do is help preserve muscle. Most of your immune system is in your muscle tissue, either in the gut or skeletal muscle. So things like the Best Way by Nutritional Frontiers, the Nido Keto Shake, and also the Super Shake. So each version of those shakes available at the Weiner Wellness are fantastic ways to make sure you're getting the minimal protein requirements in. The second thing I love is food-based. Get all your phytonutrients in. Because they'll tell a lot of people on chemo, don't take the phytonutrients or antioxidants during your therapy because they're concerned with it affecting the therapy. And we're not here to debate that. We're saying afterwards. Get them on the greens, the reds, the oranges, the purples. We even came out with an organic tincture based on Dr. Orbach's request called Superfoods that has chlorella and spirulina in it. Then you start layering on top of that with the multivitamins and some of the other food based like the fish oil. I like to start with the food first, then add on things like D3, probiotics, and enzymes. So again, back to the foundations of health, but I want to add the food back in and get them on as much of a variety of a plant-based diet as possible and very low inflammatory foods.
You could write a term paper on every single answer that you guys gave. I really want to highlight the importance of the greens because they also have those detoxification and alkalining principles.
Sure, because you want to get the chlorophyll, which produces oxygen, which gives you an oxygenated environment to hopefully prevent it from coming back.
Yeah.
So there's a question about a woman who has a 40-year-old sister who's diagnosed autistic, her sister is, and she wants to know what nutrients or supplements she can give to her for massive anxiety.
Well, I always go back to what the research shows. You know, we look at nutrients that the Autism Research Institute has used for 20 plus years. Look at the research that Dr. Tracy has presented for biohacking genetics and helping with behavioral type of issues. Look at with Dr. Weiner, all those patients over the years he treated at the Wellness Center. So DMG and B vitamins is some of the first things I go for. Fish oil, so things like Neuromax that has the B vitamins and the DMG right in it. The liquid DMG or DMG chewable and the fish oil. Those are the first things I would look at. And then more for anxiety, maybe some extra B vitamins, maybe something like Calm Day. What do you think, Dr. O?
Well, for the anxiety, I would possibly give this person the essential amino acids that they're not getting from the diet. I mean, I know that the methionine is phenylalanine. Those are good precursors to hormones and to just building blocks of the body. So the things that you mentioned, the essential amino acids, and I would also I would come back to the things I spoke about on Wednesday with the emotional freedom tapping. That the nutrient is so critically important, but it's also a good time to think about a little bit of self-empowerment and self-validation and things that you can do for yourself. And if we could have people, regardless of what kind of diagnosis they might have, to be able to do some tapping on their own acupuncture points. And if they're not capable of doing the related mantras and speaking their way through it, then just tapping has some powerful components to it. And if this person, I mean, we've had adults in the clinic who had been diagnosed as autistic, who they were really in such compromised state that literally buckled into their wheelchair. And if somebody is in that bad of a shape and they can't have that kind of motor control to be able to tap for themselves, somebody can tap for them. You can tap on somebody else's body. So I would really encourage the people who asked this question to revisit the lecture that's archived on our Facebook page where I spoke about the tapping. And if you want any kind of individual specific clarification, please reach me through that Facebook page and I'll be happy to converse about that. But you guys really summed it up beautifully with the nutrients involved. And nutritionally, the only thing I would add would be the essential amino acids to what both of you very astutely said.
Doc, I wanted to ask you too, have you adjusted a lot of autistic patients?
Yeah, well, a lot. No, Dr. Weiner primarily saw those people. And when he passed away, a lot of the autistic, the community, they fell out of our rotation and I don't know where they went. And if anybody here was formerly a Dr. Weiner patient and you decided to treat elsewhere, if you're getting good relief and help, I don't want to market or promote to somebody who's having good success elsewhere. But if you have walked away from natural health on the assumption, well, Dr. Weiner's not here anymore, there's still people here who can help you we crave the opportunity to help. Please come back. That having been said, I'm referencing this one woman in particular who I've adjusted a lot more in Dr. Weiner's lifetime. He would see her for the NAE, the Nam-Butripod allergy elimination techniques and the nutrition, and then turn her over to me to be adjusted. And this woman was I forget exactly how old she was. She was in her mid-20s. And it was literally a wrestling match that she had such poor psychomotor control of her body. And by the time we were done, she was out of breath. I was out of breath. Her father was in the room, just kind of like he and I were exchanging looks. And I know he wanted to laugh at me, but he didn't, to his good credit. And man, my heart goes out to those people. I mean, it was just, it was difficult. It was very difficult. So no, we don't see as many of those people now, but we're equipped to see them. We're equipped for that population, even in Dr. Weiner's absence.
Wonderful.
Right.
What about CBD? She wants to know. Would that be beneficial?
I was going to say that exactly.
Okay.
If we added anything else in, it would be that. Lots of great references on seizures, lots of great references on neurological disorders, so, go with CBD, go with spinal adjustment. I mean, it's all related as far as the spinal column, neurological health.
Yeah, shockingly, she said her doctor recommended CBD and to find a good source. So the Weiner Wellness Center carries an excellent source of pure full spectrum hemp extract. So she can get that there. Okay, another little simpler question here, guys. We'll back it down a little bit, but still the main question probably most people ask. This gentleman is on 3 different types of blood pressure medication and is looking to lower his blood pressure. What is a good starting point?
The best starting point.
I hope they don't say go to a 4th. Right?
Yeah, don't.
Well, it looks like if he's on 3, that's probably what they were saying. Start with 1.
Yeah, 3 for 1. I mean, if the first one didn't work, well, let's just add another one. Oh, that didn't work. Let's add another one. Wow. Okay. First thing I would say is fire your doctor. No, I'm kidding. But you want to try and relieve some of the cause, right, Jamie? I mean, this is the cause.
I mean, I did a presentation one time showing a study, and this was to a group of medical doctors, that walking and lifestyle was just as effective as blood pressure med.
Yeah.
And they said, oh yeah, we know that, but after a while, it'll go high again. I says, only if they don't stick with the lifestyle. So walking, hydration is really important, magnesium. I mean, the food, I can only imagine what the diet looks like. Maybe they're a smoker, heavy alcohol, caffeine. I mean, sugar, there's so many factors involved in this, right? Rarely, Dr. Orbach, have you seen a patient that comes in with a great lifestyle, physically really fit, with blood pressure through the roof on 3 medications? It doesn't usually occur, does it?
No. Well, to Tracy's point about her children, what did you say, 2 hours old?
Yeah, 2 hours.
I mean, you think about somebody who gets started in life so young with being educated towards the value of natural health, and I'm sure, Tracy, that your children are physical, they exercise, play sports, do things. So we see that people at some point in their life, they just decide to become a physical person and take care of themselves and get involved with natural health. And for the people who got started at such a young age because maybe their parents started them off that way or they had the influence, no, they don't grow up to be on 3 different blood pressure medications. These are the patients who I see who are 70 years old and they come in for their first visit, and part of the questionnaire is what medications are you taking, and they say I don't take anything, and we move right past that thread in the conversation onto what's next. And I contrast that with people who are grown, mature adults who only now they're on 3 blood pressure medications, and they're on digestive medication, and they're on headache medication, and they're on an antidepressant, and they're a grown adult who all of a sudden they reach that tipping point that says, you know what, I got to take care of myself differently. And they, today's the day. And when we see people in that state, we really have to start crawling before we can walk, before we can run. And we make the tiniest little changes and adjustments in their lifestyle. And the worse shape that somebody is in, the more benefit they're going to get from these tiny little actionable steps. So when we see people with these, they're on a panel of all these medications and 3 blood pressure medications, the answer, as I see it, as we practice here, is let's do a tiny little step today and reserve the right to keep adding tiny little steps every time you come in for a visit, and really turn this into a massive lifestyle change, and not to have some sort of insurmountable, unactionable protocol that really, look, we're asking you to take, you're taking 3 medications for condition A and 2 more medications for condition B, and we can't take you off of it, but here's what we'll do. We're going to add 14 nutrients to your protocol. We're never going to see that person again. I mean, you're going to go from taking 25 pills a day to 125 pills a day. We didn't, our hearts were in the right place and we knew what to do, but we created a program that was so difficult to follow. So we lost the patient. We don't have compliance. So when we see that person with 3 blood pressure medications, the answer is, you guys are absolutely right. Let's do some walking. Let's do some light exercise. Let's create a better hydration. How much water are you drinking? I think we can double that by the next time we visit. And I want you to start taking this multi-mineral or this magnesium. Every time you come in, we're going to add something to your routine here. And when you go and you see your primary care physician in 6 months or 3 months or whenever it is, surprise them.
And I'm sure that, just something as simple as breathing exercises as well. That has been shown clinically to reduce blood pressure. So there's lots of natural things that can be done.
Yeah, I like the nutrient approach of giving them what their body's depleting already with the medications, right? So Frontier Minerals, CoQ10. I would love the Power Q600 with 300 CoQ10 and 300 DMG. Just 2 formulations with some of the lifestyle therapies can at least stop the bleeding, right?
Right.
And then we can get some adjustments and some hydration and change their diet. I like that baby step so that the person can digest the recommendations, and then over a period of time, they get better and better and they keep seeing improvement. So I like it.
So I have a question for you guys. So I'm going to challenge you guys a little bit. So I think the me stories are the most powerful. What is something in the health field for your own personal health have you overcome, and how did you do it?
Well, I'll start that one. That's an easy one. And I'll let these guys think it over because they may not have any issues. Me, I got a laundry list, as we all know. So I'll start with one. I've had blood sugar and diabetes issues. And I've tried a lot of different protocols, and I also had some autoimmune with psoriasis. And lo and behold, going back to the basics with CandaKill and Superbiotics has changed me this year more than I was changed in the last 10 years in a positive way. So looking at my diet and saying, okay, this diet used to work for me really well when I was younger and training 6 days a week and no kids and no business. But is it working for me now? So one is be really open-minded that your program has to evolve. That's one thing. Number 2 is I seeked out some high-level coaching from a medical doctor that was able to do some of the testing on me I needed to get done, and just a different set of eyes and ears. And 3, I used the CandaKill, Superbiotics, and not only no cheat meals, but even really refine my carbohydrate intake, because the complex carbs that used to work for me, like brown rice, oatmeal, sweet potatoes, wasn't working anymore. So I cleaned all those out. I got some food allergy testing done that Jeff Nisnik actually had already told me, but I got the blood work done, which was confirmed by 2 different reputable sources. So that really helped me a lot. My skin's cleared up, the weight's coming down real good, the blood sugars are better, energy's up. And I feel that making that dietary change was key. But also what I did with Dr. Orbach just mentioned, I cut out one thing a day starting January. I said, what's the worst thing I'm ever eating, even if it's once in a while, out? And each day I wrote it down. And each time I took something out of the diet, I did what Tracy told me, is I added something in. And I kept a journal with that. And after about 2 weeks, there was nothing else to cut out. I mean, even Joe said one day, what are you eating?
Yeah.
I said, not a whole lot, but it's working, right? So anyway, that's what helped me with skin, blood sugar, weight, was Candid Kill, Superbiotics, and really seeking out a much new idea and concept on a food program. That's after 30
That's
years.
what I always say is health professionals and doctors are the worst patients.
Yeah, we are.
Yeah, we are.
Terrible. We're like, we got this. And then you're laying on the ground half dead and someone's like, you don't got this. So who wants to share next? A health challenge you've overcome.
I'll
How
go.
did you do that? All right.
I
great.
have two pretty brief anecdotes. The first
Okay.
one is when I was a little boy, real little, my father would get up every morning and do calisthenics on the living room floor. And that was like the greatest show on earth to me. And I would get up shortly after my bedtime to watch my dad do push-ups and squats and whatever other exercises he was doing. And let me tell you, happy was the day when my poor little noodle arms were strong enough for me to do a push-up at what, I don't know, 7, 8, 9 years old. And I've been working out in some way, shape, or form ever since. So I have about 40 years of experience as an exerciser. My other story that was highly influential was I sprained my ankle very badly when I was 16, to the point where I saw the trainer and the orthopedist and the physical therapist and crutches and ice buckets and all that kind of horrible stuff. And I was 16 in 1988, at which time we really didn't know as much about rehab as we do now. But I had access to the best that was available at the time. And through all of that back and forth between this one and that one, I knew that I wanted to get into healthcare in some way, shape, or form. I mean, even to this day, I mean, I send the NBA a letter to let them know that I'm eligible for the draft. Nobody's picked me up yet. But at 16, I was convinced that there was a possibility for me to play professional sports. When that didn't fail out,
You're too short.
My backup plan was to go into healthcare, which is where I sit right now. And then when I was in my when I was 20, I got my first ever adjustment, and it was on a weightlifting bench in the gym. And I knew right then and there that I wanted to be a chiropractor, and that was all there was to it. So that's my me story. Those are my me stories. That's how
That's
I got
awesome.
to where I am now.
Yeah.
All right, here we go.
All right.
Here we go. You guys ready?
Prepare yourself.
Do you have it, Nico?
Well, that's just it. Yeah, I do, and I'll tell you twice. This is full disclosure.
Uh-oh,
Look
here we
out,
go.
All right,
Is this
twice.
being recorded?
Twice in my life, I've had to have surgery. Now, twice. Both were because of injuries. The
I
first
didn't know you had a lobotomy. I'm just kidding. Go ahead.
not yet, but the first was a knee injury, ACL, very common sports knee injury. I got it, when I was.
We want to know how you actually got it.
I got it.
So
I
this is
was teaching martial arts at the time, and I was teaching private lessons one-on-one, and we're doing, this weird trip takedown thing, and the student locked my
What
leg.
was her name?
Blah 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 blah. Anyway, I had to go in for that. I took the advice. I went in for the surgery. I don't think today I would. My knee has never been the same ever since that surgery. The doc works on it once in a while, gets me more flexibility. And I found that over the years, now I kept thinking, why isn't this getting any better? Well, I started taking HA plus. It started to get a little better. So, there was things that even I knew I should have been doing and I wasn't doing. The other one was a sports hernia injury. And they just ripped me up. I had it on one side. They decided to repair both sides, even though the other one didn't need it. And so I've been to see Doc for that too, and he's showed me different, and he's helped me with different things I can do as well at home, but he's helped me with relief from that because both surgeries, as far as I'm concerned, botched. I'll never have another. There you go.
Well, I remember you told me too that minor surgeries only happen to somebody else, right?
Yeah.
There is no minor surgery.
Yeah.
So, how about you, Tracy?
Yeah,
Since we're all
Tracy,
sharing
come
stories.
on.
No, this isn't about me. This isn't about me. No, I'll share. I'll
We
share.
don't want to leave you out.
Oh, no, I'll share. So, Jim, you probably know a little bit of this, but about 2 years ago, I was really sick. My immune system, I can't even tell you what happened, but I really think I had an infected tooth and it went to a brain infection and it sent me into panic attacks, anxiety attacks. The left side of my face swelled up. I would lose my vision. Probably every other day I would just go black. I would lose it for like 15 minutes. The practitioners were calling it ocular migraines, except I didn't have a headache. I just went blind. And it threw me into like a state of depression and terror. And it was really debilitating. And that lasted 2 years. So that happened in 2016. I can still remember the day. It was December 16th. That's when it first occurred. And for 2 years after that, I struggled. So what pulled me out and actually got me better, because when I started working with NF in November of 2018, I was just kind of coming out of it. And I remember, if you do, Jamie, how sick I was all the time. Like I was
Yes.
just continuously coughing, constantly, always sick, always sinusy, just I couldn't get better. And I started to take DMG, vitamin D3, the liquid sunshine, and I literally go through bottles of that. That people at NF probably think I'm crazy because I order one probably every 3 weeks. I should just order it by the case. So I took EnerDMG, the Power Q, and then I started taking HA plus because I was having joint pain as well. But it was the amount that I took. I took 50,000 IUs of vitamin D3 a day, and I took 1,500 milligrams of DMG a day. And the CBD oil, I probably took 2 or 3 dropperfuls of that a day. And that's what pulled me out. I probably have never felt better in my life, but it was probably the scariest time. I remember telling my husband that I was going to die and make sure that our kids were okay, and getting life insurance policies in the same place because nobody could figure out what was wrong with me. But it ended up that I had an infected tooth, and it was a infection in my brain. So it just does show you that your body can overcome like substantial things. But it was an awful 2 years, and I'm just glad I made it. But I really think the DMG and the vitamin D were what really pulled me out. And then when we were in Florida, if you remember, we were there with Dr. Len Bransowitz, who is a pharmacist, NDMD. He told me to go home because I was right at the peak of it. Do you remember we flew home, Jamie, and my eardrum ruptured and it started to bleed? So we're on the plane and my eardrum explodes and it's bleeding out of my ear, and it's like, oh my gosh. So I went home and he told me to take just mega amounts of vitamin C because there wasn't anybody here who could do it intravenously. So that's what I did. And, in full disclosure, this is where East meets West, because I called him up and I said, listen, this is okay, but I'm not fully better. And he's like, I really think you have a bad underlying infection. He said, wherever it is, nobody's finding it. He said, call your doctor and get an antibiotic. And I was like, I don't take antibiotics. He's like, you do today. And that's what I did. I took an antibiotic for 10 days, and it was the first time in 2 years that I was better. And it was the whole gamut. It's the only time I've taken an antibiotic in probably 30 years of my life. But there are times that medicine will come in and help you. And I think people that are on this side, right, the east side of natural and holistic, we get so poo-poo over things. And I get it, but I get moms calling me all the time and saying, well, my doctor prescribed this, should I take it? I can't tell you whether or not to take it. I just know that that's your decision, and you have to figure out like when and where and how, and listen to your practitioner. So that was my story, but I've never felt better in my life.
I know.
Yeah.
Hey, Tracy, you bring about such an important point that we're not having people in the building this week, so we have we have several boxes throughout the building of notes of people who have questions for the practitioners who want to call back. And we were just talking about one this morning, Jeff and I, where this person was describing the situation that it was clearly cellulitis. And that's one of the very few conditions where I've heard with my own 2 ears, Dr. Weiner said you have to take the antibiotics for this. And
Yeah.
Sometimes we run into people who are so entrenched in medicine and don't want to hear a thing about natural health. And I think to myself, man, your pathology is the way you think.
Mhm.
But the opposite holds true too. We have we have people who are so into natural health and so blinded to there's a time and a place, and they deny that. And I think that's just as big of a pathology.
Mhm.
You are so spot on in what you said about Dr. Brancewitz's recommendation, and how you followed through is so critically important for all the people listening in, for us, for our patients, to remember. I certainly don't want to be a medical apologist, but there's a
Right.
time and a place, and we have to recognize that.
Yeah,
Yeah, that's
so
what I
it was
love.
funny because he's like, "You do today." Like,
Yeah,
he was
yeah,
so adamant. He's like, "You will call and you're
right,
gonna get this." He's like,
right,
"We have tried everything." He's
right,
like, "And I just think there's a little underlying if we just take it out." He's like, "10
uh,
days, Tracy."
right, right,
Like, "I'm not asking for the rest of your life." And I was
right.
like, "Okay." So I had to
He
get over
said,
myself,
yeah,
and actually do it.
yeah. He said
Mhm.
today. He didn't say tomorrow. He didn't
Right.
say next week. I mean, that's just look, narrow time frame,
Mhm.
and
And I
and
took
it
the
worked.
SBC with it, right? I took it
Sure,
2
sure,
hours away from it, and I kept my
sure.
microbiome in check and the
Absolutely.
superbiotics. But that's how the East can meet West, and I
Right.
don't want people listening to these streams to be anti-med. We are
Absolutely not.
giving you solutions, and lifestyle matters.
Right.
Now, am I on the antibiotic now? Nope,
No.
but for that period of time, I can probably say that my pride held me sick for 2 years. And, once I
Hmm.
listened to Dr. Len, who is a pharmacist and who
Yeah.
talks all about the dangers of medications as well as the,
Hmm.
attributes to science,
Hmm.
he was like, just take it, girl. So I
Yeah.
did. I'm sorry, Jamie, what were you going to say?
No, I'm just saying that's where I think our team's a lot different.
Mm-hmm.
Dr. Juan has all told us many times. You remember his old bumper sticker on his door, "The mind's like a parachute, only works when it's open." And I think that sometimes, we hear a medical professional that's totally against anything to do nutritionally, it really turns us off, right? Because they've tuned in and tuned out. So the same holds true too. If somebody's really sick and they have a really bad infection and they're not open to getting some medical help, that's not right either. We somewhat fall more in the middle. And I think that's where the lifestyle part separates us from a lot of programs out there, because the lifestyle part is the foundation. The nutrition falls on top of that. So the choices you have every day is most important. And even if you're taking the medicine, doesn't mean you neglect the lifestyle, right? You may have some issues where you can't get the blood pressure under control, God forbid, right? However, if you just neglect all the lifestyle, then the medicine, like we heard just now, even three of them won't work. So, yeah, I think you use a combination, and I like the fact that our team is more open. I did hear Doc many times say comment like that about medications, even though 99% of the time he would tell you to focus on the cause and the lifestyle. There were some situations, and the other thing I remember he would say about medications: take one that's been on the market for 7 years, so you're not the guinea pig, right?
Yeah.
These brand new, medications that they want to test on you, probably a good idea to have them test them on somebody else. I mean, unless you're at a place where, your life is on
Mm-hmm.
the line. So those are just some things I remember.
That was one of the things that Dr. Len and I talked about when he was telling me this. He's like, go get an antibiotic. And I'm like, well, which one? He's like, well, this one is new and it's a little bit, I wouldn't. And this one over here has been around a while. And, and this is the kind that you need because that's an underlying, X kind of infection. So it was good to have that resource. And that's why education is powerful, because he's one of the guys that will lecture for us. And he has the ability to talk about prescription medications and the do's and the don'ts and the whys in the house. And he's a great resource to ask, just like Dr. Orbach. He's a licensed practitioner. He can talk to you about specific things. So I think that's what makes the team so amazing. But last question is on probiotic and which one to choose. Right now, Diana is using the Frontier Biotic 2. How do you choose the probiotics that you talked about?
You want to go ahead, Doc? Go ahead.
I was just going to say, are we talking about keeping healthy people healthy, or is this somebody who's been on a long course of antibiotics
No, she
recently?
just takes the Frontier Biotics now. She's probably just asking, like, is that an everyday probiotic, or does she need something stronger, or should she take it every day? I think your general questions.
Frontier Biotics is an excellent choice. If we're talking about what do you do to keep healthy people healthy, and we're not talking about somebody who's been on and off antibiotics for any length of time, yeah, Frontier Biotics is good. It has a broad spectrum of a number of different species contained within. We're measuring the number of species in the billions, B like as in boy, billions. 2, even 3 a day spread out is a good dosage for a normal, healthy adult to keep their, at the very least, to keep their intestinal flora up and running.
Yeah, I think it's nice with the Frontier Biotics is that if you have anything happen over the weekend, your belly aches, constipated, little loose stools, you can always increase the dosage. It's a very similar complex as the Superbiotics. It's just 1/10 as strong. And 1 or 2 a day, I tell people it's a good multi for the gut, right? If you need a more therapeutic level, like Dr. Orbach was mentioning, you've been on IV or oral antibiotics for a period of time, you've had chronic infections, you want a higher dosage, IBS, Crohn's, colitis, Candida, then that's what I take is the Superbiotics. So similar strains as the Frontier, about 10 times stronger. And then for very specific cases, SBC.
SBC is great, and specifically if you have a foodborne bacteria that you're dealing with. It's excellent for that. It binds to the foodborne bacteria, passes it out. It's like Traveler's probiotics, right? And then if you want additional enzyme support, there's Prozyme. There's lots to choose from. Just choose one, right? One is better than nothing.
Yeah, so she said general question. She has slow digestion, so she may want to either increase her Frontier Biotics or choose the Superbiotics, and also with or without food, or doesn't it matter?
Well, in the morning, I like to take probiotics in the morning on an empty stomach, but it's the same answer. Just take them.
Yeah, I remember I asked Dr. Bland that question, and he can't give a simple answer, but he went through for about a half hour and cited 6 studies taking it without, 6 studies taking it with, and he finally just said, "Just take it." I said, "I got you." He says, "How do you like that?" I says, "Empty stomach first thing." He says, "Perfect." So that's all. Make sure you take it. As far as the slow motility with the digestion, sometimes that's dehydration. So I'd start with water and then slowly increase some fibrous foods.
Awesome. Well, this has been a good Q&A session, and I'm glad, we all put our Speedos and bikinis on today and bared everything. So that was great. Thank you so much to all of you for sharing your stories and your expertise. And if there's any questions on the Facebook page after people follow up, or on the YouTube page, feel free to just put your answers in there, guys. And I'm sure everybody appreciates your time as much as I do. So thank you. And stay tuned, because Dr. Honigman is going to bring us home today.
Fantastic. Thanks, Dr. Orbach. Thanks, Dr. Tracy. Thanks.
See ya.
God bless.
All right.